define the contours, smooth out any rough spots, and create that truly seamless transition between the restoration and the tooth.
It sounds like creating lasting marginal integrity is a combination of knowledge, skill, and attention to detail, realizing that even small imperfections can have big consequences down the road.
I couldn't agree more. Restorative dentistry is as much an art as it is a science. We're trying to create restorations that not only look great, but also work perfectly, protecting the tooth for years to come.
Okay, let's talk about some of the specific challenges we face when trying to get that perfect marginal integrity. You mentioned moisture contamination, polymerization shrinkage, and the coefficient of thermal expansion.
Those are all super important factors. Moisture contamination, that's a big enemy when we're trying to get a good bond and maintain that marginal integrity. Lots of dental materials, especially the ones that rely on adhesion, they really don't like moisture.
So keeping everything dry during the bonding process is crucial.
Absolutely. Rubber dam isolation, cotton rolls, being careful with the air-water syringe, those are our weapons against moisture. They help us create that perfect environment for bonding.
And what about polymerization shrinkage? We talked about it with composite resin, but can it affect marginal integrity in other materials too?
You bet. Polymerization shrinkage, that's the material shrinking as it sets. It can create stress that pulls the material away from the margins, and that can break the seal. We know composite resin shrinks a lot, but other things like cements and even some ceramics can shrink too.
So it's something we have to keep in mind no matter what we're using.
Right. We need to know how much each material shrinks and use techniques to manage that shrinkage stress. That's how we minimize its effect on marginal integrity.
And last but not least, the coefficient of thermal expansion. How can that affect the marginal seal over time?
The coefficient of thermal expansion tells us how much a material expands and contracts when the temperature changes. Ideally, we want our restorative materials to behave the same way tooth structure does.
So when we have something hot or cold, the restoration and the tooth expand and contract together, so you don't get those gaps at the margins.
Exactly. If the coefficients are way off, the restoration and the tooth will do their own thing, expanding and contracting at different rates. That creates stress that can lead to microleakage or even the restoration coming loose.
It's amazing how these little details can have such a big impact on how well our restorations hold up over time.
It shows just how complex restorative dentistry is and how important it is to understand the science behind the materials we use.
Okay, so we're almost done with our deep dive, and I'm really struck by how much you've emphasized communication and patient education. Why are those things so important in restorative dentistry?
Communication and patient education are absolutely key to getting good results. Patients need to know what their options are, what the pros and cons of each material are, and how important it is to take care of their teeth at home if they want their restorations to last.
So it's about making patients part of the team, not just someone we're doing something to.
Exactly. When we explain why we're recommending certain treatments, listen to their concerns, and involve them in the decisions, we build trust, they're more likely to follow our instructions, and ultimately we get better results.
But how do you explain complicated things like marginal integrity, polymerization shrinkage, or the coefficient of thermal expansion to someone who's not a dentist?
That's a good question. It's all about using simple language, avoiding jargon, and making comparisons to everyday things. For example, we can compare marginal integrity to a container with a good seal. If it's sealed tight, nothing leaks out.
Visuals could be really helpful too, right?
Yeah.
Things like diagrams or models.
Absolutely. Visuals can make a big difference when you're trying to explain a complicated idea. They help patients understand what we're talking about and why it's important.
So good communication takes empathy and creativity. We need to connect with our patients on a personal level and give them the information they need to make good decisions about their oral health.
I completely agree. When we communicate openly and honestly, we build strong relationships with our patients, they're more likely to accept treatment, and we can all work together to achieve that ultimate goal of optimal oral health and well-being.
This deep dive into restorative dentistry has been amazing. Your insights and knowledge are really impressive.
Thanks. It's always fun to dig into this stuff and chat with a colleague.
Before we finish up, there's one more thing from your notes I wanted to touch on. You mentioned the future of restorative dentistry, like how new technologies and materials could change things. What are you most excited about?
Oh, there's so much to look forward to. Dentistry is changing so fast. One area I find really interesting is smart materials. Imagine materials that can actually react to what's going on in the mouth. They could release medication when needed, repair themselves if they get damaged, or even change their properties depending on the pH or the bacteria in the mouth.
Wow, that sounds like something out of a sci-fi movie. Materials that can sense and react to their surroundings. How do you think that will change how we practice dentistry?
I think it could totally revolutionize restorative dentistry. Instead of just fixing problems, we could be actively promoting healing and preventing new issues from popping up. Like, imagine a composite resin that releases fluoride whenever it senses acid from bacteria. That would be huge for fighting recurrent decay.
That would be amazing. I know you're also a big fan of biomimetic dentistry. Do you see these smart materials fitting into that approach?
Oh, absolutely. Biomimetics is all about copying nature's designs. Smart materials that can adapt and respond to the mouth are a perfect example of how we can use those biomimetic ideas to create better, more natural feeling restorations.
And we can't forget about digital dentistry, right?
Mm.
3D printing, intraoral scanning, CAD CAM, they're already having a big impact.
They really are. These digital tools are making us more precise, more efficient, more predictable. We can create custom restorations that fit perfectly and work the way they're supposed to. And I think we're just scratching the surface of what's possible with digital dentistry.
It really feels like an exciting time to be in dentistry. There's so much happening with materials, technologies, and treatment ideas. It feels like a whole new era of restorative care.
I totally agree. It's inspiring to think about how these advancements will help our patients. We'll be able to preserve more natural tooth structure, make things more comfortable for them, and create restorations that look great, feel great, and last for a long time.
This has been a fantastic deep dive. I've learned so much from you today. Your passion for restorative dentistry and your commitment to staying on top of things is truly inspiring.
It's been my pleasure. I always enjoy these kinds of conversations, exploring the ever-changing world of dentistry with a colleague.
And to our listener, we hope this deep dive has given you some valuable insights and made you curious about the world of restorative materials and techniques. Keep learning, keep exploring, and keep pushing the boundaries of what's possible in dentistry.